Good evening, everybody. It is so good to be with you again via Heart for the Community Initiative interview series. Welcome back. I know it's been a while since we've done a live one, but we've been busy, been very busy. So glad that those of you who are taking the time to tune in this evening, this is a very important informational interview. We have had Mary Chamberlin here before. She's from the Rappahannock Area Health District of the Virginia Department of Health. Our last interview with Mary was very successful. A lot of questions about COVID-19 were answered, questions about the virus itself, questions about testing, especially in our local area here in Northern Virginia, and a lot of questions about the efficacy of the Pfizer, Moderna, Johnson& Johnson. There was a lot of stuff going on. And so it's been a couple months, and I think with May, it's been since May, and here we are in September. And so we're probably overdue for an update. But here we are this evening. We've got some visual information that we're going to show you. And I want to let you know that Mary is absolutely ready for your questions and your comments. So we're looking forward to a very informative session here. And I will tell you, I know some of you are going to catch this live, and then there will be some of you who will see this by way of playback. I would tell you, don't be afraid to share this video so that some of your friends and family can see it. Even if you're outside of the state of Virginia, let me tell you, some of this is going to be general information for the COVID-19 virus itself. And I hope that we are still remaining vigilant. There are variants that are very dangerous. And I know that some people are distrustful of the government and all those kind of things. But hopefully, this informational session will knock down some of the rumors and some of the misinformation. And believe me when I tell you, we don't come from any type of political ideology or any political party of thought. It's not like that. It is strictly information to help keep you safe. Remember, that's one of the big things that the Heart for the Community Initiative does through its interview series is to provide our area with information, especially Prince William County, Stafford County, these areas, Fredericksburg, and the surrounding areas. All throughout the state of Virginia, we have viewers and in other places also. So, Mary Chamberlin, welcome again, my friend. We're so glad to have you here.
Thank you, Carl, and I'm really glad to be here. I can't believe it's been since May. When you said that, I thought, wow, it has been since May, right?
Yeah,
So who knew we'd still be talking about COVID to this extent. So, but here we are. So yeah, I'm happy to be here. Thank you.
all right. So, the last time we were here, it was the first time a lot of people really got in depth about COVID-19 information. And we were in a different posture. Like you said, it looked like we were just on the cusp of coming out of it. And to a certain extent, that was
Yes.
true.
Hmm.
But I think people got relaxed, and with these couple of variants that are out there hitting different regions at different times, and even like right now, we see there are certain places in our country that are really struggling with this virus. So, if you would just begin to tell us what's going on in the state of Virginia and in our local area here.
Well, unfortunately, in the state of Virginia, cases continue to increase, as do hospitalizations and even deaths. As been the trend from the beginning of the pandemic, when cases rise, generally you'll see hospitalizations and deaths lag a few weeks behind those increases in cases, and then you'll start to see those add up as well. I'm sure we've all heard the stories about hospitals being overwhelmed with COVID patients, having to turn people away sometimes. Luckily, that's not happening in our specific area here in Virginia, but what's happening anywhere else in the country could very easily happen right here. So one of the things that the Rappahannock Area Health District really wants to impress upon everyone is that our behaviors have so much to do with driving the trajectory of this pandemic. So it's really important. We keep going back to the same messages over and over and over again, but there's good reason for that. The science is there. It shows that the vaccines are safe and effective in keeping us out of the hospitals, in keeping us from dying, even in slowing the spread of the virus, in stopping mutations from forming. We also know that masks do work. It's so great to go, yes, the masks are off, and go about life as normal as we could have done. And that's been a little bit of a problem for some people. But, you know, we like to just say, hey, you know, we've done it before. We probably have a nice collection of masks sitting around. We might as well go ahead and use them. This isn't forever, you know, it's just for now.
Right. We appreciate that. What are some of the challenges that you're seeing in a Rappahannock area health district concerning the virus and the public's perception and their questions and concerns?
So probably, and this probably isn't specific just to our area, but I can speak to it in our area. We're seeing a lot of just people are tired of COVID. They're just there's COVID fatigue. They don't want to talk about it anymore. They don't want to hear about it anymore. They just want to get on with their lives. Again, we got a little taste of that, especially early in the summer, and people don't want to be pulled back into um, restrictions or different safety mitigations that they were glad to get rid of. And we see also, Carl, a lot of apathy. And the apathy is coming from, we have people who are vaccine hesitant. We hear that term a lot. And those people, they're not anti-vaxxers, not anti-COVID vaccine. They have really good reasons, a lot of them, for being hesitant. And we're very compassionate and we try to understand and work with them on those reasons. The people who are apathetic are just like, yeah, you know what? It's not, it isn't a thing. So they're not really hesitant. They just don't really seem to care. And that's a big problem. It's especially a big problem with our younger population, those 18, 21 to up to 39 years old, people who view themselves as young, fit, and healthy and able to.
So let me ask you this. It seems with all the conversation about the variant, of course, there was debate on the efficacy of the vaccinations themselves. For me, I'm not sure what you're, I don't hear too much talking about testing. And it
Mm,
seems that there seems to be, for those who, like for employers, many
mhm,
employers are saying, listen, you're going to either have to be vaccinated or you're going to have to bring us, a positive test on a weekly basis, whatever their policy is.
right.
Are you getting a lot of questions about testing? Are we seeing the testing numbers level out? Are they dipping? Uh, are people still encouraged to get tested?
We're encouraging people to get tested now more than ever. In the Rappahannock area district, which is, it makes up the counties of, let's see, Caroline, King George, Spotsylvania, Stafford, and the city of Fredericksburg, we are seeing a positivity rate, percentage of people who are being tested who turn out to be positive, over 12%, which is way too high. So, 10% is a big red flag. So we're well over that at this point. And we are encouraging people to get tested. So many of us are so used to maybe saying, I have a sniffle, maybe it's allergies, I probably picked up a cold. In the time of the COVID-19 pandemic, you can't be too careful. So it's just easy. Just go get tested. Just make sure. Certainly, if you are a part of a contact tracing effort and you've been informed that you've been exposed to somebody who has tested positive, you would be somebody who would be tested. Certain employers, as you mentioned, require testing on a regular basis. Congregate settings, we're talking about like long-term care facilities, maybe some colleges, maybe healthcare professionals would get tested on a regular basis as well for very good reason. So testing is more important now than ever.
Oh wow, that's great to hear. I would think that,
Yeah.
but I just don't hear about it as much as we used to, and I'm very concerned. Now, there seems to be some confusion. I've heard arguments say, "Listen, well, why should I get vaccinated?" Because we hear about vaccinated people not only still contracting the virus but spreading the virus, and some of these vaccinated people find themselves back in the hospital. And what I've been telling people is, listen, you got a better chance with the vaccination. The vaccination most likely will keep you out of the hospital. You may contract COVID, but you most likely won't get sick enough to have to be hospitalized. It
Right.
appears to me, and I'm leaning on you for some factual information, it appears to me that the efficacy numbers were right around the mid 90s. And from what I understand, same thing with the hospitalization rate across the nation and even in Virginia. From what I understand, now, like I said, I'm looking for you to give me some facts, but I think that over 90% of hospitalized persons in Virginia and in the United States with COVID are unvaccinated people. Do the facts bear that out?
Yes, it's very true. Forgive my cat. I have some rescue kitties, and I have this one who's just so naughty. He loves to jump on my desk, so I hope you guys like cats. Um, so yes, the vaccine. I think a lot of us were under the misconception that the vaccine would prevent any type of infection. They don't necessarily prevent all infection, but they are very, very, very good at preventing disease. So, you and I getting sick from COVID, we may be able to be infected still, but we may be able to spread it. But studies are showing now that those of us who are fully vaccinated have a have generally milder symptoms, if any symptoms at all, and we have that shorter duration means that we're not able to spread it as long, so to as many people. It sounds like it's tomato tomato, but these are really important factors. The vaccine is keeping people out of the hospitals again, and it is keeping people from dying. Yes, there are some people who will require hospitalization, and sadly, there have been some people who have passed even though they've been fully vaccinated. Again, nothing is 100%, but I in just 2 months, hospitalizations have increased. I'm reading something I printed out by 1,008%, and new cases have jumped by 1,217%. So hospital inpatient and ICU beds are filling up with the unvaccinated. The vaccinated people are just a small sliver of the people who are hospitalized at this time. Oh, you're muted.
Yeah, just caught myself. Thank you. First
Okay.
question here from Gary. He's asking, will booster shots be readily available after 8 months of the last vaccination shot?
So it's an excellent question, Gary, and it's a really important topic, the topic of boosters. So I will just back up a second to talk about the difference between third doses for those who are immunocompromised, which people are eligible for now, and booster shots, which we're not sure if we're going to have. We're not sure if they're going to be approved yet. There's been a lot of talk. We expect they will be. The FDA advisory committee is meeting on Friday to discuss that, and we should know more after that. 8 months has been talked about after your second dose of an mRNA vaccine. The boosters would only be available this time for people who got Pfizer or Moderna. The Johnson and Johnson booster potential is still being studied. So more to come on that when information is available. But so right now, if you are an immunocompromised individual, you are eligible for a third dose. It's it's not called a booster because immunocompromised individuals, we've realized, did not mount the same antibody response after two doses that the general public did. So it's important for those individuals to get that third dose. And as far as the boosters, we've heard 5 months, 6 months, 8 months. It seems like 8 months is the standard right now that we're hearing. So they will be readily available. There is not a short supply whatsoever of vaccines, not like in the beginning. We have an abundance of vaccines available. So if and when boosters are approved, once you've met the length of time after your second dose, you can go into any pharmacy, doctor's offices, the Rappahannock Area Health District, Prince William County Health District, wherever you would get a vaccine normally, and you can get it there.
All right, wonderful. I've had a person to tell me that they recently did get the vaccination because finally the FDA had given the full approval to Pfizer. So I understand that some people are,
Right.
who may be a little hesitant. They were waiting for the full authorization. Do you have any information on when we may get full FDA approval for Moderna and Johnson and Johnson, and if there are any other vaccines by any of the vaccine makers that may come to the market soon here in the U.S.?
So that's a great question. My information and research is that Moderna will most likely be applying for full FDA authorization soon. And Johnson and Johnson, I haven't heard about full authorization for them as of yet, but I'm sure they'd be right on the heels, because they came a little later than the mRNA vaccine. As far as other vaccines in production, a lot of us have heard of AstraZeneca. That's been given in other countries outside the U.S. I don't know that that's going to be approved in the U.S. But again, we have an abundant supply of the existing vaccines that are approved under emergency use authorization or now authorization from the FDA. So we don't have to worry about having a shortage of any kind.
Thank you. Here's another question. Gary asked, is there a list on the Rappahannock Area Health District page that lists the immunocompromised illnesses?
That's a great question too, Gary. There's actually a link, and we do have, let me see, I'm going to drop this, let me pull this up here. The CDC has a comprehensive list, and keep in mind that if you're a medical professional, if you're a physician, were to say you didn't have a condition that was on the list, but they said, I really recommend you get this because I think you have an issue that probably you don't have enough antibodies, that's perfectly fine. People are not vetted when they go to get these boosters now. They're not asked to provide any kind of proof. So, talk to your medical professional. Let me see if I can pull this up and get that link.
We appreciate this information, Mary.
Sure. There's so much of it, so I can only imagine what it's like for the general public. I deal with this all the time, and I still have to look things up constantly. So I just dropped that in. Did you get that?
Let me see. I do believe I did. All right, wonderful. I'm going to post this so people can see. Give
So
me
it's got some
just a
really good
second.
information on this page for moderately to severely compromised people. And one question I've been asked a lot actually is if somebody has an autoimmune disease such as lupus, it's been brought up, would they be eligible? So full disclaimer, I have lupus and I am not immunocompromised at this time. The reason being I'm not taking immunosuppressive drugs right now. So there are lupus patients and other autoimmune patients who are, and I have in the past, so I might have been eligible another time, but right now I'm not. So again, there are some factors to discuss with your doctor. we're all individual. We might not fit neatly into a list. So that's important to remember.
I want the audience to know that the banner that's running at the bottom of your screen right now, this is a link that Mary gave us for those who want a list of those immunocompromised illnesses so that you'll know if you are eligible for that third shot. They're not calling it a booster, they're calling it a third dose.
Yep.
And Mary has explained that. We have another question from Gary. Uh, does the Rappahannock Area Health District have an official position on masks for children in school, or does the district adhere with CDC or state guidelines? Parents throughout Planning District 16 are struggling with this subject.
Yeah, another great question, Gary. And that's been a controversial topic, to say the least, for a lot of people. But where RAHD stands is we offer guidance, recommendations. We help walk the school systems through both because it can be a little muddy at times. We do not impose any rules or mandates of our own. We're strictly here for that guidance. So each school division makes their own decisions. However, there is an order in place in the state of Virginia now that was imposed by Dr. Norm Oliver, our state health commissioner, that masks are required in all K through 12 schools. There are some exemption possibilities or exceptions. However, those need to be taken to the schools themselves to be approved. Again, RAHD does not have a hand in that. So I think what's been frustrating is that there are schools that do things differently than maybe the county right next to them or the city right next to them. And parents wonder, well, why? Because the school systems have been given that flexibility, that autonomy to decide what they feel is best for their community of students and teachers. And we do our best as a health district to support the schools because I can say for our school systems, they're very good. The representatives are very good at really looking at the data and taking into account what's happening in the communities when they make decisions for their students.
Thank you so much. Well, Mary, you sent me some information, and I want to get this
Mm-hmm.
out to
Okay,
our public. I'm going to start
sure.
with this graph here, and
Mm-hmm.
this graph is for Virginia positivity. It says the number of testing encounters, number of positive testing encounters, and percent positivity. Can you explain
Okay.
what the audience is seeing here?
Right. So you and I were just talking about this before we went live on the broadcast that I can throw numbers out all day long, but I think visuals are much more impactful. This is a 6-month graph. So this shows you, if you go all the way back, if you look at the left to March of 21, we were just starting to come out of the post-holiday surge that was so awful for all of us. And then you can see that very sharp decline over the summer into late June. And then from there, obviously, the trajectory went just the wrong way. Percent positivity is one metric that we look at that lets us know of all the people who have been tested, whether it's in the state or a specific district, county, city, how many of those people, what percentage tested positive. So it's a subjective number because you can have a lot of people coming and being tested who are asymptomatic, and only a few people with symptoms. It's kind of a gray area. But what we do know is that we do not want to be above 5%. Ideally, we want to be where we were way back in, well, it wasn't that long ago, but in June, you can see we were under 2%. That was amazing. We hadn't been there before. So we reveled in that for those few weeks. We definitely do not want to be above 10%. 10% is a red flag. It lets us know that there's not enough testing going on in the community and there's widespread transmission. So that's what percent positivity is.
All right, that was for the state of Virginia. I'll show this graph now for the health district that you represent, the Rappahannock
Mm-hmm.
Area Health District. Can you explain this, please?
Yeah, so this is just scary. It's just not what we want to see. We're at, I think, 12.6% today, 12.4%. We're over 12%. So we've just been going up and up. And even though we dropped down a little bit, we're blipping back up again. There are a lot of people testing positive for COVID. Now, I can't tell you how many of the people testing positive have even one symptom at all. There could be some asymptomatic people in this group. But the bottom line is the people who are testing positive can spread the virus. So it's very important, again, to be tested so we know if you need to quarantine, if you need to isolate, if you need to take extra precautions, if you need to segregate yourself in your home away from your family. Those are very important factors in stopping the spread of the virus.
Wonderful, thank you. And here is the graph for Prince William County. We know that you're not employed by them, but I have an audience in Prince William County, so we added this information.
Yeah. Yes. So Prince William County has actually, you can see they kind of hit right about 8% at one point, and then had a drop, and then came back up to just, where I guess it's 7.5% today, which still isn't where we want to be at 5% or below, but doing a little better than REHG. I do have to say that I checked Prince William County's vaccination metrics before I came on with you today, Carl, and it's 75% of Prince William County residents have received at least one vaccine, one dose of a vaccine, which is phenomenal. That's just fantastic. And I have to say that probably goes hand in hand with a bit of a lower percent positivity. REHG, on the other hand, is at 62% with at least one dose. So we have some ground to make up there. And, you know, the more people are vaccinated, the fewer cases are going to be in the community.
Right. All right. Here's a case, a graph for Virginia cases. And I'm not
Mm.
sure what the difference is between the cases and the positivity, but I know you're going to tell us.
Well, so again, the positivity rate is, just say, 100 people got tested and 10 of them tested positive. That's 10%. That's the positivity rate. These are actual cases. These are actual case numbers. So you can see again what a beautiful dip there was for some time over the summer, which is when we all started to get very comfortable, which, we all understand why. Look at that. We were doing great. And then unfortunately, we're spiking with some very high case counts at this time. So we're seeing numbers. I know in the Rappahannock Area Health District, again, we're seeing numbers that we haven't seen since back in February, which is just the wrong direction, obviously.
And I'm going to go there right now. And this is the graph
Mm-hmm.
for the Rappahannock Area Health District.
Right. And you can see one thing to look at too is besides the line, which is a good visual, if you look at the actual blue spikes, those are case numbers per day. And I mean, my goodness, the last one today, we had 250 cases reported in just one day. That's really, really high. So as opposed to, if you look back in June, there's some little blue, they look like dots that go underneath the baseline. We had
Mm-hmm.
negative numbers some days. And the negative numbers were because of quality assurance that's ongoing. We discovered some people lived maybe outside of the area, so they were removed. Maybe someone it wasn't COVID after all, so they were removed. There are a variety of reasons, but we had so few cases that we actually went into the negative for quality assurance. So that was fantastic.
Wow. And here's the graph for the Prince William District cases.
So again, you can see when it's the negative numbers back in probably mid to late May, and very recently have started to see some higher spikes again. One thing to mention, and for the Rappahannock Area Health District, I do post this every day on our social media. We have a surveillance report for COVID, and when we get cases reported to us, they're reported by 5 p.m. the prior day. It doesn't mean that someone tested positive, all those people tested positive on that day. That's when the testing centers, urgent cares, doctors' offices reported to us. So there can be some variation here and there. And one of the reasons that we like to focus on 7-day averages to really show us trends, because again, with quality assurance or maybe a lag in reporting from some labs, numbers can go up and down a little bit, but in a 7-day period, they can flush out.
Okay, wonderful. Here we got some vaccination information here. This is state of Virginia vaccination case rates. Could you explain this to us, please? I think Mary's
So this is a
video just
great
froze.
graphic. You can actually
Okay.
read right here. I'll read it out loud. But during dashboard, vaccine dashboard, every Friday. So it's a little behind. So during the week ending 9/4, unvaccinated people developed COVID-19 at a rate 15.1% times that of fully vaccinated people. So that's a huge number. 15 plus times unvaccinated people developing COVID than fully vaccinated people. That really tells us something. And actually vaccinated. So hopefully those are, just waiting for the time period to come up for their second dose. They didn't just not get their second dose. We wouldn't want that. But so that yellow line that you see are unvaccinated people, and that dark blue line are fully vaccinated people. It's just quite a difference. And again, I think pictures really are worth 1,000 words when we look at things like this.
I hope that as people view this, they do understand that you and I we don't have any agenda here other than just to get the information out. So I'm hoping that people will trust what they see.
Right.
This is just data, people, nothing else. All right, now those are the Virginia
This is
cases. Here
just
are.
data, and
Go ahead. I think Mary's
oh, I'm
audio.
sorry. No, I was just going to say that this data is available on the Virginia Department of Health website. So, and it's accessible by anyone at any. This is public-facing information.
Wonderful. And here we see I think this is the hospitalization rate if I'm not mistaken here, correct?
And then you just pull up
Hey Mary, we're having some issues with your audio.
hospitalization.
So what I'm gonna do, having some issues with your audio, you were going in and out.
Correct.
So what I'm gonna do is I'm just gonna read this graph for the people. So
So
for the people, you can see that week ending 9/4, September 4th, 2021, unvaccinated people were hospitalized for COVID-19 at a rate 16.2 times that of fully
and
vaccinated people
again,
and 2.9 times that of partially vaccinated people. All right. And here's another graph that
people who
shows
weren't.
you. Go ahead, Mary. All right, we were having some issues here, some audio issues. We'll try to get Mary back here. Mary, I'm not sure if you can hear me, but we're having some audio issues here with you, and your video is freezing up. We're not sure if there is a an issue on your end. But while you're doing that, we're going to look at some of the comments that have been made. And I think Gary, he pinned it all when he said COVID sucks. So as you see, Mary has had some technical difficulties. More than likely, what she's doing is she's going to jump off and come back into the studio. And when she gets on, we'll continue. And I want Gary and Paula to know, Miss Oppenheimer, we uh, we see what you're saying here, and we're going to deal with your comments and your questions, even though you're coming from a different point of view. But we'll see if we can get answers to that. Thank you so much. I'm sure we'll see Mary uh, try to get back in here in the studio in just a moment once she fixes what's going on her end. But listen, so far so good. We've had some good information. Hey, Mary, welcome back.
I'm sorry, I don't know what happened. I
Yeah,
had to restart some things. I apologize. I was just, wow, it wouldn't be a lot of growth
no problem.
without a problem. I apologize.
Hey, Mary, we have someone who is looking who has some. I'm going to put this here. This is some interesting comments. Sheeple beware. Paper and cloth are breeding ground for microbes. Each
So the
time
last
that
thing we left off on, I was talking about was hospitalizations and this.
yeah, we did. We're going to come back to it. I want to deal with this comment here. Can you read that? I think Mary still may be having some either audio or problems with her.
Oh, yeah. Can you hear me? I'm
I hear
sorry. I
you
see
now.
everything fine on my end, but I don't know why it's glitchy. I keep checking my internet. It looks fine. I don't know what's going on.
It's okay. I'm going to be quiet
Um,
and let you talk. You see this question, right?
I do see the question. Yeah. So masks do not breed microbes. They don't carry bacteria that make us sick. They don't force CO2 into our lungs. Masks are perfectly safe. They're perfectly fine. And this has been a campaign of misinformation that's been around for some time since the beginning of the pandemic. Um, and I have a little graphic I actually made that's some really cute sheep with masks on. I love sheep. They're wonderful. They're adorable. I'm happy to be a sheep any time of day. But um, one of the examples I've always given people is just think about our medical professionals who are in hospitals, in surgery, suites for 8, 10 hours at a time in masks. They're not passing out on the floor from CO2. They're not developing massive bacterial infections. It's just misinformation.
All right, we have another one. The vaccine actually enhances the virus's ability to enter and infect your cells, resulting in more severe disease than you had not being vaccinated, supposedly by Dr. Joseph Mercola. Have you seen this before?
I have heard of Dr. Joseph Mercola, and this is one of the instances where I'll mention, just slide in here, know your sources. You find trusted sources, stick to them. Dr. Joseph Mercola is considered the most influential spreader of coronavirus information in the medical field. So there are various reasons for that, but a quick Google search will tell you what you need to know. So unfortunately, just because someone is a medical professional doesn't mean they're a trusted source. That's hard. So many of us grew up, we trust our medical professionals. We trust our doctors. We don't second guess them. But at this time, for whatever reason, there are people who are on the wrong side of information, and Dr. McCullough is one of them.
Thank you for clearing that up. And I don't want anybody to think that we're avoiding your questions, but I like to get that out there because I know there's a lot of misinformation, and I'm so glad you were able to deal with those two comments. So, Ms. Paula Oppenheimer, I hope that some information that was shared here helps you. All right. And here's another question from Gary. What programs or initiatives are underway to get people in our district to get tested?
So, Gary, for one thing, the Rappahannock Area Health District has expanded testing. We weren't doing our community testing over the summer because it wasn't necessary. There were test centers available everywhere. There wasn't, the surge in cases there are now, and the transmission levels that there are now. So we have added two um, free drive-through community testing events per week. They're in various areas within our district. I know Prince William County has done the same. I have communicated many times with the public information officer there, and I see that her posts, and there are plenty of testing clinics available. The I did just send out today a newsletter, so just put that out there if anybody's interested. We do have a weekly newsletter that comes out with what important information or information we feel is important for our communities on Fridays. But I did just put out that we have learned in our district there are urgent care centers who are now only testing people who are symptomatic because of the high caseload, the high transmission levels. They just can't test everyone. So if you don't have symptoms, they won't test you. So we do advise that if you're going to get tested or planning to get tested somewhere outside of your local health district's free community events, that you call ahead and you make sure that they'll be able to accommodate you. But for me, public information, I mean, information is what I do. So I'm constantly posting on all of our social media platforms, and we have many, and in our newsletter, that testing is just as important now as ever, as I mentioned at the top of the show, if not more so. And I have a little hashtag I've been sticking on just about everything that's vax, mask, test. So just going right back to the basics, right from the beginning. Testing is very important to know and start to slow the transmission in our community.
All right, we do have another question. Gary is being good to us this evening. Seems to me that everything reversed when the CDC said vaccinated people didn't have to wear a mask this summer.
Yeah, yeah, that's certainly a thought that's out there. We CDC is our trusted source, and we do understand the reasoning behind allowing those who are unvaccinated not to have to wear masks. One of the reasons is because it was an incentive. It was, hey, you got vaccinated. Here's what you get to enjoy now. And I do support that on a personal level. I do, because there were some things we didn't know at the time, like this Delta variant was going to come racing around from around the corner, and be so quick to infect so many in our community. So science is constantly evolving. It's fluid. Fluid is my word of the past 2 years. We want our scientists and our medical professionals to adapt to the changes that are happening. We don't want them to put one message out and then see that there's medical or scientific proof that perhaps that message isn't the correct one any longer, and then stick with it anyway. We don't want that. So there are going to be some bumps and bruises along the way when it comes to changing messaging. But again, I fully trust that, of course, the Virginia Department of Health and the information that the REHD puts out as well. So if people could just try to understand, again, we want that fluidity. We want an evolution in messaging.
As best you can, could you explain to people who really don't understand the variant, dealing with the Delta variant now, but there have been others, and there are probably going to be more. Can you explain what that is so they can have an understanding of that as best you can?
Sure. So from a non-clinical standpoint, just in terms of messaging, Delta is a variant, and it's known to be more transmissible. It's highly transmissible. We don't know yet. It doesn't seem that it can cause more severe illness. Uh, that's still being studied, but we know it's highly transmissible. So whereas the original variant of COVID, if say you, Carl, were infected with that original variant and exposed, you could infect say 2 people. Now with it also seems to last longer for those infected. So people are infected longer or more infectious longer. So you can infect up to 5 people. So it's two and a half times more than two times. So, so it's more transmissible, which is why the safety messages, the mitigations that have come down, especially recently, like going back to masks. Um, the mask recommendations, it's important to note, are for even those of us who are vaccinated. If we are in a public indoor space, we should mask if we're in an area of substantial or high transmission, which pretty much is all of Virginia basically, but it's most of the country. So it just really behooves all of us to take precautions to protect ourselves, regardless of our vaccination status. Again, I know it's inconvenient for some people, especially because we were able to take them off for a little while being vaccinated. Um, but those of us who got vaccinated, I believe, being the optimist that I feel I am, we got vaccinated not just for ourselves, but for our communities, for the people around us, for the people we love, for the greater good. We want to end this pandemic. So those are the same people that put a mask on, no big deal. I kind of I'd like to think that we're going to be just fine wearing a mask if we need to.
Thank you. I'm going to see if we're good enough to go back to the last graph that we were looking at. We
Sure.
got a little interruption there, but we were talking about the COVID-19 hospitalization rate
Mhm.
in Virginia. Could you explain this here?
So this is actually the case by vaccination status. If you want to go to vaccination rate, that may be in something else, Carl, that I gave you, or I could actually go over that. I did print that out myself. So bear with me while I shuffle some papers. So the vaccination rate in Virginia, it varies. We do have some variance in some of our areas. But one of the things that I wanted to mention was that we're doing pretty well with our Latino and Native American communities, our community members, Asian and Island or Pacific Islander, we're doing well with vaccines. But our white and black community members in that younger age group, we have quite a ways to go. We're basically at 45% with at least one dose. It's not where we want to be. So we're still trying to appeal to those younger people. The state of Virginia actually is doing, sorry, I should have probably had that pulled up for you. Let me see if I can find that. State of Virginia is doing well. We reached the 70% threshold set for us by President Biden fairly early for at least one dose. But what happened after we reached that, we just like sort of dove off the cliff as far as that trajectory. So it was exciting to get there, and then we sort of stalled. So we definitely,
Was that right
definitely
around the June, July timeframe?
that seems to be when everything happened. Yes.
Yeah, everybody got
Yes.
relaxed.
Yes. Yes. So yeah, vaccination rates. One thing I can say, I monitor the Rappahannock Area Health District rates, obviously, and I put out a weekly report. um, we're still going up. We're not stagnant. We may not be seeing the increases we'd like to see weekly, but we're still seeing increases. And I know that's true across the state. So slowly but surely, we're getting there. We just need to help people understand the importance of getting vaccinated now. For those who were hesitant early on, say they wanted to wait to see how other people did, we're well beyond that now. There's so many people who have been vaccinated in this country and in the world. I think we're good to know that we're all doing okay. So, there's again that very well. There are a lot of reasons. There are some cultural reasons. People have religious reasons, trust in government reasons. There's all kinds of reasons, and we're again very compassionate when it comes to talking to people. If they're not strict anti, there's that's sort of well, okay. But people who just need the right information, we're doing everything we can to get it to them.
All right. What are the the questions that people ask when they either come to see you guys or they call. What are people really trying to get to understand about either testing, the vaccination itself, the variant, or just general information? What are people asking?
That's a really good question. So the number one question we're getting to our call centers and probably for me through messaging is about the boosters and when they'll be available and how will I get them. A lot of people are asking, especially those in our communities who are seniors. They were among the first, as you might remember, to be eligible for the vaccines when they rolled out, and it was a bit it's, oh, sorry, I got a kitty again. It was a bit scary in the beginning because there didn't seem to be enough vaccine for everybody. And he's going to try to knock this down. Sorry. This is what makes my life interesting. So it's not the case now, as I mentioned before. We won't have lists of people who have to register. We won't have to go through all of that. So that's a question we're getting a lot. And another question that we're getting is about quarantining with the schools, as Gary brought up. There's some frustration with parents. There are school systems who have quarantine periods anywhere from 7 to 10 days for students and teachers. So, or I'm sorry, 7 to 14 days, which is a big variance. I mean, it can be frustrating if you know that the school system next to yours or is allowing children to come back at 7 days and you have to do 14. So we get questions about that a lot. And again, as a reminder, REHD just offers guidance. We don't, enforce anything, mandate anything. We do go over also, and this is very important too, and it's a great incentive for getting kids vaccinated, the 12 to 17-year-olds who are eligible. Fully vaccinated students do not have to quarantine. If they are not showing symptoms, they don't have to quarantine. So that helps the kids to stay in school. So we get that question a lot as well. And people are still wondering about isolation and quarantine and what the difference is. Isolating if you have tested positive, quarantining if you're a known close contact. So we go through a lot of those questions as well with people. So beyond that, sometimes explaining the data as we've done tonight, people ask us to walk them through what the numbers mean sometimes. So it is really good for people to understand. And we understand, I certainly understand how much of an overload of information there is out there. Even if you were to say to somebody, hey, you can just go to the dashboard and see that, people don't know what they're looking at. I've been doing this for some time now, and there are still some things I have to decipher. I have to take some time and look at. And even if I understand it myself, maybe I don't understand it enough to be able to explain it to somebody, so we get it. So we're definitely here to help with that as well, so people understand what's happening in our community and what those numbers mean for them as a community member.
This is great. Before we sign off this evening, I just want to make sure if there's anything that maybe we did not cover tonight that you definitely want to share with the audience, here is your opportunity to do it.
Oh, thanks. So I think that the biggest message I'd like to give everybody is, honestly, just as a regular person to other people in my community, just hang in there. Especially those of us who have been fully vaccinated. I know that it seems a little frustrating. It seems like we might be going backwards, but COVID-19, and particularly this Delta variant, is very serious. And we are still seeing people become extremely ill, hospitalized, and we are still losing people in our community to this disease, so to the virus. And this past week, we lost 2 individuals in their 30s and 40s. So just here in my community. And it's just not what I want to see. It's not what any of us want to see. So, do what you need to do to stay safe. First and foremost, please get vaccinated. If you have any questions at all about the vaccine, about whether it's safe, please talk to your medical professional, your doctor. Reach out to us. if you're in Prince William County, reach out to the Prince William County Health District. We're here to help you and to answer questions. And we're not here to change anyone's mind. We're not here to convince people of anything. We're here to provide the best information we can to empower you to make the choice that's right for you and for your family. For your children, if you have children over the age of 12 and over, please get them vaccinated as well. As of right now, 25% of our COVID cases nationwide are children. That was not the case with the initial variant. So we're seeing Delta is very different. And I will say, as an aside, Carl, we're not seeing more severe illness in those children. I don't want people to be fearful and panic, but we are seeing infection in those children. And being a mother myself, my thought process is I don't want to take the chance that my child is going to end up as a statistic. Most children do okay, have mild symptoms, but most is not all. So, so don't take the chance with yourself or with your kids. We're hopeful that the vaccine will be available for those age 5 to 11. We've heard anywhere from maybe the end of October through the end of December. Whenever it comes around, be ready for that. Be ready to get your younger kids vaccinated so we can keep all these kids in school. We can keep them all safe and healthy. So I think that's probably my biggest message right now.
One quick question, very quickly. Do you have any inkling of information of when we may have some type of approval for vaccinations for those Americans under 12 years old?
So that's that 5 to 11 group, Carl. And as of right now, we're seeing that it could be, at least with, so Pfizer is the vaccine that's approved for anyone under the age of 18. So we're seeing that Pfizer plans to submit for emergency use authorization for that age group sometime in either late this month or in October. So we're hopeful that if that happens, the process will run fairly smoothly and we'll be able to get those children vaccinated. My best guess, based on all of the research I do and what the professionals are saying, is it will be by the end of the year. So, yeah.
All right. Well, Heart for the Community Initiative, you have been graced this evening with the information from Mary Chamberlin, who works with the Rappahannock Area Health District of the Virginia Department of Health. This is her second time on with us. And of course, you know, we're going to bring her back. We'll give some time for this stuff to develop, and we'll ask Mary Chamberlin to come back and give us some more information. Once again, we want you to know that we don't come from any type of ideology. This is strictly information, the factual information, and the best and the latest information that is available through the Rappahannock Area Health District. We did post information for the Prince William Health District also in those graphs, because I know that we do have an audience in that health district area. So if you would like to contact Mary, there's some information scrolling across the bottom of your screen right now. She did offer the information because she wants to be able to help those people who have questions. I do want you to know that after the last time she was here, we did have a tremendous question to answer. And you can find that on the Heart for the Community Initiative Facebook page. If you go through our videos, she was here in May and she provided some information. I did get several contacts after the interview, people telling me that they were very hesitant about the vaccination. They had questions about all type of things concerning COVID-19. But after the interview, they had gotten the information that they needed to make the best decisions for them and their families. And that's really what we're trying to do, to provide the information. Of course, what you do with the information is totally up to you, but we do want to give you factual information. Please, Mary has said it, I've said it, and I'll say it again. Please, please, please make sure that you're getting your COVID-19 information from reliable sources. And because a person is in the medical field does not necessarily make them a reliable source. Please do a little research. You'd be surprised what you can find on Google. to make sure that these people are giving you the real information. And we don't want to spread information that we're not experts on. I'm an expert on a few things, and I spread information on that kind of stuff. Those issues where I'm not an expert, I go seek out the experts, and that's why we have Mary Chamberlin here this evening. Mary, we thank you so much. We really do. Thank you for your time and your information.
Thanks so much for having me, Carlin, and thanks to your viewers for some great questions tonight too. I really appreciate it.
All right, everybody, we're about to sign off. For all of you who are catching this on the replay, if you have questions or comments, you can either email Mary, you see her information below on the screen, or you can add your question or comment to the comment stream. I'll absolutely see it. If there's something I need to forward to Mary, I'll do that. If it's something that I can answer myself, I'll do that too. And don't think that we'll just deal with questions and comments that are in agreement with the information that we've shared. If you have something that is contradictory, we'll deal with that too, because we want to make sure we get you the information. All right. So that is all for now. Thank you so much for your time and attention. Until next time, be blessed and get the right information so you can make the right decisions for your family. We'll see you next time. Bye bye.